my channel, all my queen moms and king dads. Welcome. Of course, it's your favorite midwife, Midwife Nashika, at your cervix, ladies. So, of course, today we will be talking a little bit about cesarean section. Yes, cesarean section, and also we want to discuss VBAC, vaginal birth after cesarean section. So I want you to come along on this awesome journey as we are about to discuss cesarean section and VBAC, vaginal birth after cesarean section. What is the difference between a elective cesarean section and an emergency cesarean section? You know, sometimes you hear say, oh, she have emergency section. You know, what's the difference? An elective cesarean section is when you have made a decision, a conscious decision. Your doctor, your OBGYN, and you had the conversation prior to. And because of whatever reason, it can be because of issues with mommy, or it can be because of issues with baby, that your doctor decided that instead of having a vaginal birth, we're going to allow you to have a cesarean section. All right, and that is planned. You go in at a specific time and you are booked for a cesarean section, and it is done within that specified time. I must also point out that an emergency can occur, and the date that you had actually planned, or your doctor had actually planned for you to have that elective cesarean section, it can be put off, and I've seen cases where that will happen until another date, because sometimes persons with emergency, maybe even an emergency cesarean section, arises and the doctor would have to do the emergency first. I kind of explain what an emergency is then, right? That is exactly what it is. Like the name suggests, it's an emergency. That is, anything can happen while there's an emergency, or there's a need for an emergency cesarean section. Almost anything. One instant is you could be in labor for a long period of time. We call it prolonged labor, and the doctor decide that, hey, you're in labor too long, the baby is not making its way down, you know, there's no progress. We call it failure to progress. There's no progress, and so the doctors may decide, along with, you know, your midwife that is caring for you, that you need a cesarean section. So that's just one of the factors. All right, but there's so many other things that can happen, and they decide that you need an emergency cesarean section. Please also keep in mind that the decisions that your doctor made, I have heard persons say it, and I don't like it, not because I'm a midwife. I've heard persons say, me not like go down at the hospital because they like fi cut. They like fi cut, you see? Nobody likes to cut. If it is not necessary, and I can guarantee you that all health facility doctors, nurses, midwives, or the operating theater staff, everybody will want us to have a spontaneous birth. Like, if we could have all spontaneous birth. Not only does it take up more resources, both human and non-human resources, but also for you, the recovery time from a cesarean section is way more. So you know what is going to happen? You, instead of spending a few days, instead of spending a day, 24 hours or so in the hospital, you do a cesarean section and you have to spend at least 3 days in the hospital. We don't want that. Despite popular belief, the midwives, the nurses, the doctors, they want you to get well and go home. All right, so that's it. With that being said, when you're having a cesarean section, as it relates to, so persons have asked, like, will they put me to sleep? There are different forms. It's not a must that you are placed to sleep and have an epidural, right? And this, of course, will again be determined by your anesthesiologist and your OBGYN. All right, so they will determine whether they give you a general anesthesia, which they put you to sleep, or they give you epidural, which they just deaden the lower part. So you are awake, but you won't be feeling anything because your waist, below your waist, is is dead. All right, I'm trying to explain it to you the best way I possibly can. Also, for a cesarean section, in order to prep for a cesarean section, you need to ensure that you have recent blood results. All right, so remember, during the antenatal period, you need to have your blood test done at least twice throughout the pregnancy. So the one that you would have repeated at 32 weeks, you need to ensure that you have that. Of course, blood donors, blood donors, blood donors. Someone asked in a previous video that I did, I believe they asked if it is necessary to have blood donors. And I like to put things in perspective for persons when they ask certain questions. So think about this. From time to time, we hear the blood bank. The blood bank says, you know, that they're short on blood and they need persons to donate blood. And so, can you imagine you having an emergency cesarean section and hear that there is no blood for you to receive? I'm not saying that you will, but I'm saying put yourself in that scenario. Suppose it happens, because if they're short on blood, the possibility does exist, doesn't it? So if your family members go out and you're pregnant and they go to the blood bank and they donate at least 2 units of blood, can you imagine that that will just help the blood bank and decrease the shortage? Yeah, man. So listen, if you can get 2 persons, you're pregnant, 9 months, 2 persons to donate blood on your behalf. Find out where the nearest blood bank is. Tell them your correct name. Don't give them your alias now. A friend can do it. It does not have to be your spouse. It does not have to be your family member. A friend can do it and ask them to donate blood on your behalf. Save a life today, because remember, the life you save might very well be yours. Next thing is that you will need to be shaved. You can carry a razor blade, you know, one of the stick razor, just in case. You can have your spouse or whomever shave you. But sometimes after you have shaved, sometimes the midwives, they still need to do a little bit more shaving in preparation for the surgery. And so I would advise you to take a little one of those stick razor, right, in order for you to be shaved. All right. In preparing for your cesarean section, you will, once you're admitted to the ward, in case of an elective now, after 10 p.m., you will not be given anything to eat. So the midwife, the nurse that is on the ward, they will tell you, do not have anything to eat. Remember, you're for surgery. I have seen cases, and it's so sad, where women go against this advice and they eat, because sometimes too it's out of frustration, because maybe the day before your surgery was postponed, you know. But remember, I said that especially if you're there for an elective, an emergency can come up, and it is necessary, it is important, it is life-threatening. So the doctors would have to make the decision to do the emergency cesarean section before the elective. All right? Apart from your general consent form, because when you're admitted to a unit, to a ward, to a facility, you usually sign a general consent form. Apart from that, separate and apart from that, you will also need to sign a consent form for surgery. This is where the doctor and the midwife that is on the ward, the doctor will explain to you, with a nurse being a witness, and they'll explain to you what are some of the possibilities of this surgery, what are some of the possible outcomes of this surgery. They will seek your permission to give you blood if you need it, to save your life, to, you know, all of those. To save your life, you know, I mean, to give you the blood to save your life. You know what I'm saying, right? Right. So all of those will be included in your consent form. All right. And of course, they will explain it to you step by step, and you will be asked to sign once you agree. All right, and IV access is usually placed in your hands for hydration purposes, meaning to keep you, because you won't be eating, you need to be kept hydrated. So an IV access is usually inserted, you know, then put on drip, right? So they put on a drip, And so that is for hydration purposes. Again, one of the many myths that is out there is that once you get an IV access, a pain them a send on. No, even if the pain comes on after getting the access, nobody's sending on pain, because you're there for an elective cesarean section. If the pain comes on, naturally fine, but nobody's going to send on pain while you wait for an elective cesarean section. All right, the midwife usually gives medications prior to you going into the operating theater. We call them pre-op meds. You're right, they're usually administered. Remember as well that a urinary catheter is usually inserted, right? So this process, usually it's when you're on the antenatal ward that these things are done, or sometimes in case of an emergency, sometimes you may even be in the labor room or on the labor ward. And so wherever you are, but a urinary catheter is usually inserted. Once again, ladies, it will be uncomfortable, but you know that it has to be done. And so I ask that you prepare yourself for it to be done. One of the many things that helps, the more relaxed you are, it's the easier it is for it to be inserted, and it's easier for the process to be completed. Both for you and your midwife, it becomes easier. So just try to take some deep breaths. I always say, you know, in through your nose, out through your mouth, and try to relax. All right, if you're not sure what is happening, then you ask. All right, so versus if you're planning a vaginal birth, or vaginal birth is what you will have when you are having a cesarean section, the things that you need for the baby becomes less. All right, so for example, you will need, your midwife will ask for a few things. That is 2 receivers, 4 pads, hats and socks, diapers, and olive oil. Diapers in case of 2 babies, or diaper in case of 1 baby, which is Pampers. Same thing what we call Pampers, yes. All right, so that is what your midwife will ask for in order to send them with the baby to the to the operating theater. So what happens now? Now you have the baby, now you're out of the operating theater and you are at the postnatal ward. Usually you are not, and I'm saying this as well to the king dads and to the queen grandmas and the king grandfathers and big sis, little sis, everybody. I'm saying this to you. Your relatives cannot eat rice and peas right away. It has to be gradual that they come back to the rice and peas thing. All right, so as it relates to food, you have to start off usually for the first couple of hours. You still don't eat anything. You continue on your IV fluids, right? And so you start on your liquids and you gradually go up to your solids. All right, your hospital stay, if there's no complication, your hospital stay can be at a minimum of 3 days. All right, it can be more depending on you, the person, depending on your caregiver. So that depends on the doctors. Remember as well that doctors will come around to do their ward rounds. Your nurses, your midwives will be there to do your blood pressure, to do your daily checks, your blood pressure, your temperature. They will be there to dress your wound. Wound dressing is done every other day, depending again on the condition of the wound. And so it might even be necessary for it to be done every day, right? So it depends on the condition. And so those things are done after the cesarean section. Remember as well that after you have had the cesarean section and you're being discharged from the hospital, then you will get a referral to go to your nearest health center for dressing. And I must stress that you will get a referral to go to your nearest health center for dressing. If you don't get it, you can ask about it. Politely ask, am I being sent for dressing, or will I be sent for dressing? Right? Because I've had situations where persons have actually gotten the referral and they don't take it. They just stayed at home and they don't take it. When they come now 6 weeks later to 6 weeks later, what happens is that they end up having an infection and all sorts of problem there. So ensure that you get a referral and you take it to your nearest health facility. It is also recommended that a waiting period, I must stress that as well, that a waiting period between pregnancies, so you have to ensure that when you come to 6 weeks clinic, you have already a method of family planning in mind, because after a cesarean section, we recommend that you at least wait 2 years. 2 years, at least, the least. So it can be more. Like I know some people going 7, 8, 9, 10 years. So it can be more. But at least the minimum 2 years before you decide to get pregnant again. And for that, like I said, you go to your doctor or your midwife at the clinic, and they will be able to provide you with some family planning methods, including the injection, including the copper T, you know, that will aid you in spacing your children. All right, yeah, so that is it. Quite a bit, isn't it? Yeah, so that is it for now on cesarean section. So we're going to talk about vaginal birth after a cesarean section, or VBAC. Having one or not having one is dependent on a lot of things. All right, and so one of the things that, like, one of the most important factors to consider is why you had a cesarean section in the first place. Because like I said before, people have cesarean section for different reasons, right? And so, for example, if it was something related to baby that you had your first cesarean section, then the likelihood of you having another or having vaginal birth is more than if it was something related to you, the mother, why you had a cesarean section in the first place. You get that? So if it was mommy related, it's less likely that you can have a vaginal birth. But if it was baby related, like for example a big baby, then it is more likely that you can have a vaginal birth. Also the type of cesarean section that you had. So the type of cut. So if for example you had one of those cut that comes down in your tummy, we call it classical. If you had one of those, then the likelihood of you having a vaginal birth after one of those is very, very limited. Also, one of the main factors that determine whether or not you are one of those persons that will have VBAC or vaginal birth after cesarean section is if you have ever had a vaginal birth before. So if you have had a vaginal birth before, that increases your likelihood of having a vaginal birth after you have had a cesarean section. All right. If you have had a history of uterine rupture, meaning your uterus ruptured, then it tear the muscles, them it pull apart, the cord pull apart. Then let me put it that way for better understanding. Then you are not considered, you're not one of those persons that are considered for a VBAC. The possibility exists as well of having a uterine rupture or the uterus rupturing while you're having a vaginal birth. So it's yes, it is very serious. It can be very serious. And though the incidences of vaginal birth after cesarean section, those incidences, successful cases are a lot, but the uterine rupture is still a possibility, something that can happen. All right, so we have to consider that as well. If you have had surgery for fibroids or anything like that, then you're not one of those persons that we consider or that would be considered readily for a VBAC if you have had surgery to remove fibroids or any such thing. Some other things that decreases your likelihood of VBAC includes advanced maternal age, post dates, meaning you're gone above that date which you are supposed to have baby. Excessive weight gain during pregnancy. If you have high blood pressure, especially if that high blood pressure comes with fitting or headache and swelling of the feet. If you have had a baby delivered by cesarean section for under the 2-year period, if you have 2 or more cesarean section, then the likelihood of you having a spontaneous vaginal delivery is decreased as well. Also, I must also point out, if labor is not spontaneous, so meaning if labor did not occur by itself, like just come on, and you know there's a need for inducing labor, for sending on pain, then it's possible that it's not going to happen. You won't have a vaginal birth if they have to send on the pain. All right, so just keep all of those in mind. Some of the benefits of it is that, of course, it reduces your waiting time in the hospital. It reduces the amount of time you spend in the hospital. So if you have a vaginal birth versus a cesarean section, you know, you can be out of the hospital in 24 hours, all being well, versus in a cesarean section where you'd have to wait 72 hours. Of course, you can get back to normal activities quicker. There is less chances of, there's decrease blood loss and all of those things, and so less resources are used as well. And all of those are some of the beautiful benefits of having a vaginal birth after cesarean section. All right, in the event you should attempt vaginal birth after cesarean section and uterine rupture occurs, that is the tearing of your uterus, breaking of the uterus, rupture, right? If that should occur, then in most cases, the removal of your womb, your uterus, right, is what is done, or an hysterectomy is necessary in order to save your life. All right, so have this discussion with your midwife, have this discussion with your doctor, with your OBGYN. At most times we don't, at the primary healthcare or at your clinics, if you have had a cesarean section, then you are sent to the Iris clinic where you're attended to by your OBGYNs. All right, and so have your discussions with them as it relates to, am I right for VBAC? Is this right for me? And remember to listen to the advice of your OBGYN. I am absolutely certain that they will do what is in your best interest. All right, if there is anything that you are unsure of, remember to ask them. Remember not to be afraid to question them, not to be afraid to say, you know, I heard this and I just want to clear things up. I want to know if it's true. And then with that collaborative effort between you, Queen, King Dads, and you know, your practitioner, your obstetrician gynecologist, then you can come to the decision of what is best for you. Goodbye for now. I hope that this video helped. Really, I hope that it helped. Don't forget, guys, to like this video, subscribe to my channel, share it with your friends, share it with the lady you meet at clinic, share it with the pregnant lady you just see on the road, share it with your neighbor who is pregnant, share it with the future queen moms and the future king dads, future queen grand. I saw queen auntie coming, and queen aunties, you know, share it, share, leave a comment, like my video, and if you have not yet subscribe to my channel. What you waiting for? It's pure awesomeness going on over here. It's your favorite midwife Nashika, signing out for now, guys. See you on the next video. Goodbye, guys.